Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. In this video, let's take a look at how you can manage and heal vaginal dryness with natural and effective therapeutic tools. For many women, menopause can be a dreaded process, especially if you only hear the bad parts about it. But no matter who you are, where you're from, and if you're a woman, at some point in your life you will experience menopausal symptoms, and that can include vaginal dryness or even bleeding after intercourse. So let's take a look at this and enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and your likes, as they all help the growth of my channel. And lastly, have a look at my website, medicanova.net, at the online academy, where you will find comprehensive certified home study online courses in homeopathy applied for the whole family, or if you want to use homeopathy during pregnancy, birth and postnatal care. Another course for integrated mental health, health coaching, quantum healing, and so much more. So take a look here. So let's move on. What is vaginal dryness? Well, women of any age group can suffer from vaginal dryness, but especially women who go through the menopausal transition time are more affected here. So the lack of vaginal lubrication mainly leads to pain during intercourse, and there is actually a medical term for it. We call it dyspareunia, and this can be accompanied sometimes with an itching sensation or burning or even bleeding at times while coition happens or after intercourse. But apart from menopause, childbirth can be a cause, lactation, anti-estrogen drugs, there are many causes which can cause vaginal dryness as well. Sure, it helps to see menopause as a natural progression of aging, but I tell you, most women really are affected more with the emotional and the physical changes. And it's not easy sometimes. So transitioning through menopause can mean dealing with also unwelcome symptoms. Some experience weight gain. Suddenly you blow up, or you have a low sex drive, low libido, low energy in general, and not to mention the incredible mood swings. Right? One day you're fine, the next day you just break out in tears, or the hot flushes, you can't take it anymore, and you don't know what's happening to you. Menopause is the permanent end of a woman's menstrual cycle and therefore her years of fertility. Technically, menopause is considered to start 1 year following a woman's last period. So this means that 12 months after your very last period, you're officially entered, or you're in menopause. But menopausal symptoms can start even during the official, date, so to say, or start of your menopause. And this time period signifies the end of reproductive ovarian functioning and the transition through various hormonal changes. Menopausal symptoms usually first appear around your mid-30s, sort of around 35, when your ovaries get smaller and stop producing the hormones estrogen and progesterone, which we need in order to regulate the menstrual cycle. Menopause involves many natural changes to a woman's entire reproductive system, even including the internal organs, right? From the external genitalia to the uterus to the ovaries, but also maybe the breasts get smaller, to various reproductive and non-reproductive hormones. So around the time of your mid-30s, your ovaries start to produce less estrogen and progesterone, and therefore your fertility starts to decline. Now, prior to menopause, right, during your reproductive years, we have a hormone called estradiol, is the major form of estrogen, and which is primarily released from the ovaries. Now, after menopause, the form changes into estrone, which becomes the most abundant type of estrogen released at that point. And you maybe will be surprised. It will be released from the women's fat cells. Right? That's why weight management is really important here, because we don't want to store the estrogen, we want to release it, and the adrenal glands. So if your life is very stressful, if you worry a lot, if you can't sleep, your adrenal glands are weakened and stressed out, and therefore cannot produce or give you enough estrogen. Estrogen works by attaching to receptors on cells within the tissues, including those in the uterus, the breasts, but also the kidneys, the heart, the blood vessels, and other tissues of a lesser degree. However, the most significant changes taking place in a woman's body during this transition are that there is an increasing loss of ovarian follicles, and therefore a decreasing amount of estrogen being produced. So mature follicles secrete estrogen. And so as the rate of the follicular loss, keeps accelerating, less estrogen is therefore produced. And that is really the cause of your vaginal dryness. Now, we all know menopausal symptoms, or even have heard about them, if you haven't reached that age yet, from irregular periods, the hot flushes, the night sweats, the mood swings, and the vaginal dryness. And in this video, I heavily focus on the vaginal dryness and give you some ideas and tips how to meet this situation. The vagina technically shortens and loses its elasticity here. And the vaginal thinness and dryness can come along with more of a higher susceptibility to urinary infections during that time. Because of the lack of lubricants, you're more open to bacterial infections. I talked about the weight gain, particularly the abdominal fat, because of the slower metabolism. So exercise is really important here. Insomnia, changes in your sleep rhythm, dryness of your skin, thinning of your hair, less sex drive, low libido, the mood swings, the breasts maybe become smaller, changes in your uterus, your cervix, and your ovaries. And others maybe experience more cardiovascular diseases. Heart disease comes more to the forefront. And of course, we want to mention osteoporosis. So what is the conventional treatment? Well, if you have experienced chemotherapy, radiation, or received hormone replacements already, or even had surgery of removal of your ovaries, you already have experienced hormonal changes and you're more affected. And this is one of the reasons why women who have had these medications or experienced this surgery or undergone these treatments in the past tend to go through menopause at a much earlier age than those who haven't received these treatments. As a healthcare practitioner, especially with the focus on integrated medicine, hormone replacement therapies, in my understanding, should be the last resort on your list of options. The reason is today we have enough studies which show us that hormone replacement therapies come with a truckload of side effects and can activate more serious illness like breast cancer, heart disease, stroke, blood clots, urinary incontinence, and even depression and memory loss. In fact, one of the largest studies, the Women's Health Initiative hormone program sponsored by the National Heart, Lung and Blood Institute, the National Cancer Institute, and parts of the National Institute of Health, found that women on estrogen replacement drugs were 24% more likely to develop breast cancer compared to women taken no hormone therapy medication at all. And I think here it is important to educate yourself, to make the right decision, an educated decision. Right? What is best for you? And also go back and ask your mom, what was her menopause, because often we take on that same pattern. Of course, if you suffer and you can't, face each day anymore, of course you have to reach out and, go for more drastic interventions. But as I said, hormone replacement therapies, educate yourself, right? Because it's also comes with another sort of side, which, we don't want to deal with it in years to come. So menopause can be confusing, can be overwhelming, can be daunting. But here and I will give you great tips how to meet this situation with your vaginal dryness. If you're interested in a health consultation, either for yourself and your children, contact me at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. Let's move straight into the natural treatment protocols. Today I want to leave out the food for thought and metaphysical meaning again, because vaginal dryness is really a result of hormonal changes. And yes, it can bring up, therefore, mental and emotional disturbances like low sex drive, your relationship, your marriage is affected, and so on. But I don't want to make it too complicated here. This situation, really, women just want to have the tools to get out of this situation. So let's move right in there. I would say exercise, main part here. I mentioned that, the hormones sort of store in the women's abdominal fat cells here. Exercise, it produces more serotonin, your mood changes, not only you sleep better, your appetite increases again. So bring that in, right? It should be part of your daily regime. I also would add herbal preparations, herbal supplements, because they contain natural hormones, hormone balancing properties that help you to ease during this transition. And the most common ones you see in supplements are ginseng, evening primrose oil, licorice root, black Koch, of course, due to the hot flushes, wild yams, red raspberry leaves, St. John's wort, maybe because of the mental, emotional mood swings again, chaste tree, sarsaparilla, maybe red clover, it's a great detoxifier. If you like more Ayurvedic herbs, you want to go into ashwagandha, shatavari, daruhaldi, ashoka, and so on. But here, talk to your naturopath, talk to your homeopath, to your healthcare practitioner, what's the best product for you out there. Each one of the herbs, they have specific symptoms or sometimes symptoms that is able to treat them as well. With it comes a healthy diet, because during this time, going through all this mental, emotional, and physical changes, you don't want to add toxins to your body. You want to release them, and therefore bringing life-affirming, life-giving food, fresh food, vegetables, organic food. I know right now we have inflation. I know everything is more expensive. But, rather drop the bag of chips or the ice cream in the night and bring in more good food, right, in order to help your body to go through this time much easier. Sugar, really affects it. For example, when you go through menopause and you have a glass of wine in the evening, well, during the night you have more hot flushes, right? You pay the price immediately for these kind of deviations. And sure, life should be fun, but be aware about it. Or drop the bar of chocolates in the evening if you can. External lubrication applications are suggested here as well. They're on the open market. Go online, you see tons of them, and they also provide powerful hormone-free relief from vaginal dryness, often with an easy-to-use vaginal insert, or they come in cream consistency. And they renew also the body's moisture for everyday comfort in your intimacy. But I'm not really affiliated to these companies, and therefore I'm really not marketing them here. But I want you to be aware about them and choose the right one. Natural kitchen pharmacy is really a combination out of olive oil and coconut oil application that would work as well. If you have an itching sensation, maybe you want to bring in aloe vera gel. It cools down the inflammatory aspect. Others suggest maybe a wash from nettle or chamomile tea or comfrey root wash. All of that helps as well. I've read tea tree oil mixed with coconut oil is suggested, but here I want to be careful because tea tree oil can be very strong. I would just use, organic, fresh, virgin, cold-pressed olive oil or coconut oil. It does well the job. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3 months coaching program. I'm coaching you to be well. Let's move on to the third part of this video, homeopathic remedies. So in my experience, I'm doing this for decades now, being a homeopath and doctor of natural medicine, I found that homeopathic remedies here are very effective. They're brilliant actually, especially for vaginal dryness, because they're natural and they work at the root level to increase vaginal lubrication. Right? Most of the products just help you just to have a little bit lubrication when you need it. But these remedies actually, align the body. So it actually creates a little bit more lubricant on a natural basis. These remedies are very safe and without any toxic side effects, which I love. And they can therefore be given to all women, of all age groups. Homeopathic remedies are most effective in treating complaints of painful sex and bleeding after intercourse from vaginal dryness, but also women who go through menopause, with the hot flashes, with the low libido, the low energy, the irritability, the mood swings, and so on, really help here as well. The top 3 remedies in my toolbox are Sepia officinalis, Lycopodium, and Natrum muriaticum. Sepia, you will see in this video, covers a lot of kaleidoscope of symptoms, so it's my first choice most of the time. It's indicated for vaginal dryness, where painful sex is there, bleeding often results with intercourse. Sepia is an excellent remedy here for vaginal dryness in women, especially when they go through menopause. Right? Remember that. Because in homeopathy, we want to choose the remedy according to your individual expression and your individual symptomatology. So if you have painful sex and bleeding, sepia is maybe a remedy. But if you have maybe the burning sensation only, then another remedy is indicated. And I want to educate here. So you can choose these remedies. And the remedies I'm talking here are actually available in your health food store, or you can order them online. You don't need to be, to consult a doctor here. Of course, it's best, please do so. But I want to give you some self-help tips here as well. I talked about Lycopodium is another remedy where vaginal dryness is accompanied more with the burning, right, sensation. I just mentioned that. Natrum muriaticum, one of the 3 major top remedies, is indicated for vaginal dryness where you have more the itchiness, the soreness, or the smarting pains. But that's go more into detail here because I really want you to understand what homeopathic remedies can do here. For more guidelines and how to take these remedies, contact my practice, Medica Nova, at health@medicanova.net to book your appointment, or of course contact your healthcare practitioner. So let's look at the remedies sepia, officinalis, and lycopodium 30. The potency is 30. It's the number behind the name. And when you go to a health food store, that usually indicates the potency, the strengths. And you can have 6 or 30. That's usually over the counter. Some health food stores also provide 200 as a potency. But here, let's go nice, slow, and easy. And rather stretch the treatment out for a longer period so the body can adjust. So sepia 30. Sepia is fantastic for vaginal dryness, and it's a top-rated remedy here. Comes also maybe attended with some itchiness, definitely vaginal dryness during intercourse, and also indicates the use for this remedy. Best suited for vaginal dryness during menopause and also after childbirth, because it's a remedy which is very related to hormonal changes. The sex drive here is 0. Don't look at me, I don't want anything to do with this, low libido, that gives it away. Sepia is the cuttlefish, right? So the homeopathic remedy is made from the cuttlefish. And if you have some time and look on YouTube and watch nature programs about the sexual coupling of the sepia, the cuttlefish, you will understand what a sepia woman is going through, right? It's like, it's fantastic how nature shows us and educates us what's going on. And then we have here the remedy and of course seed matching the same frequency in a woman with the same symptomatology, the same personality expression. And then you bring in the same match and voila, it helps beautifully. So, as I said, the sex drive is very low. With lycopodium, you have more the burning sensation accompanied with dryness in the vagina. If the vaginal dryness is especially during menopause, not just outside or because of hormonal medication, but sepia would come here as well. But especially during menopause, I would give sepia 30. Again, sepia comes in occasional bleeding in such cases after the intercourse, vaginal dryness, hot flushes, mood swings, all accompanied with the menopausal transition. With sepia, there can be also a bearing down sensation in the uterus or even a prolapse of the uterus. Very specific for these remedies. Natrium muriaticum, on the other hand, natrium muriaticum is sea salt. That's the essence of it. Is most effective among remedies for vaginal dryness, which comes with this soreness or the itchiness of the vulva and the smarting pain along with the dryness in the vagina. Again, there can be definitely pain with intercourse. Now, I want to talk about the pain more. Vaginal dryness can come with excruciating pain. I mean, I have women talking to me and said, I just hold my breath during intercourse. I'm bleeding. It's so uncomfortable. And, I just can't take it anymore. So what to do? And I want to give you 2 remedies here. We want to differentiate them. Again, sepia covers a wide range here. Vaginal dryness leading to this medical term, dyspareunia, which is really pain during intercourse. And it's a really good choice here. Bleeding may occur, appear during coition or after intercourse. And the women who are prescribed sepia usually, as again, have a low sex drive. Irritability, mood swings. Platina, on the other hand, it's like platina, like the most precious, metal here, works very well where there's a hypersensitivity of the genitals, almost accompanies with vaginismus. So when they go to a gynecologist, for example, and they're about to begin, an examination, platina women would freak out. The muscles would contract. They hardly can be touched. It's really uncomfortable. And platina works very well for these women. There can be maybe itching involved with the dryness of the vagina, but here the sexual desire is actually quite high, and that differentiates it with the remedy sepia. Sepia always has low sex drive, right? Whereas platina, no. They're still active, they want to have this sexual interaction, but they're very sensitive around the vaginal area. Let's quickly have a deeper look at this dyspareunia, this painful intercourse situation, because it's a real issue with women, and I have a lot of patients sharing that with me. It is a common problem, and many women tend to face it at one point or another in their life. The pain in dyspareunia can be felt at the vaginal opening or deep also in the pelvis. There can be burning involved, aching, throbbing pain even, and it varies, of course, from case to case. Again, sepia is a very beneficial remedy here. Females needing sepia experiences intense pain during intercourse. In such cases, the vagina is dry, extremely tender. The sexual intercourse is almost intolerable. That's really what the woman is saying. I can't take this anymore. And blood may appear from the vagina after coition in some cases. There also may be some other aspects involved, like pelvic diseases, ovarian cysts, endometriosis, uterine fibroids, pelvic inflammatory disease. I'm not saying it's just, the vaginal dryness. So there can be a bigger picture involved here as well. But sepia is the leading medicine here for managing the complaint of painful intercourse, especially women who go through menopause. Remember that. Again, low libido, hot flushes, vaginal bleeding, and also on. Often we see this sadness with sepia and also an indifference, therefore, to life in itself, right? They're dealing with all these symptoms already, and almost they, feel like, actually, I don't care anymore, right? I don't care. I'm just going through so much. That's the kind of indifference. And that can even be indifference, a feeling to loved ones, right? You become sort of blasé about everything, even to the needs and desires of your own children. And it's not that you're cold-hearted or you're not motherly, far from it. You are very motherly and you have done everything right. But menopause just pushes you through the very, wall to say of tolerance in dealing every day, with all these challenges on top of your own challenges. So sepia can be so helpful here because it not only will help you with your vaginal dryness or the bleeding, during intercourse, but it also will realign you mentally, emotionally, and spiritually as well. I've seen many husbands coming to me. They want to pay me more because they suddenly have the wife back. It's like homeopathic remedies are gold cent here. I really cannot stress it more. Now, we have other remedies for this painful intercourse. I mentioned Natrium muriaticum, when you have this itchiness, platina again, where you have the sensitivities, but we have also Argentum nitricum, Staphysacria, Creosote, Ignatia, and Lycopodium. But here, I don't want you to get confused. I want you to contact your local homeopath who is trained, who has the the skills to see which remedy would fit you most. I want to talk about bleeding after intercourse, right? We talked about painful intercourse, vaginal dryness, and now we talk about bleeding after intercourse. And here I want to again mention 2 remedies. One is called Argentum nitricum, and it's for vaginal dryness leading to bleeding during intercourse. The most prominent among are these remedies, Argentum nitricum and sepia. Argentum nitricum, which is actually silver, that's the compound, is most suitable among remedies for vaginal dryness in cases where sex is painful and bleeding follows intercourse. Argentum nitricum women are more anxious. They feel like claustrophobic a bit, often feel like mentally, emotionally they're trapped, and then they get out of it, they panic easily. So that could be part of it, right? You are enjoying your intimacy, and then the pain comes, the bleeding comes, and you feel trapped and you just want to get out of it. Argentum nitricum would be a great remedy here. Sepia, on the other hand, again, an excellent choice here for bleeding after intercourse arising from vaginal dryness when you have women going through menopause. What happens is women then have an aversion to sex, and that's just sad, really a sad experience. So let's tackle this in a more natural and organic way. And I think I want to stop here. I gave you enough information, as otherwise this whole thing becomes too overwhelming. But to summarize, you as the aging woman, you do not have to suffer in silence and just swallow the aging process with its kaleidoscope of symptoms. With vaginal dryness, I truly believe the long-term treatment plan with homeopathic remedies and lifestyle changes is the key here. I would say, if you have vaginal dryness, try CPO30, 1 tablet daily, and try it out for 4 weeks or 2 months and see how that works. Of course, you need your professional guidance here, but that's my sort of slant here. So I hope that today's video has inspired you again to seek out more natural solutions. If you have any questions about the suggested treatment protocols, contact my practice Medica Nova at health@medicanova.net, or you can also go to my website medicanova.net. And don't forget to have a look at the online academy, where you will find certified, comprehensive, usually 16 weeks university standard educational courses in homeopathy. For you can apply it for your family, for your loved ones. Homeopathy applied during pregnancy, birth, and postnatal care, so important here. If you ever wanted to know more about integrated mental health, how to meet Alzheimer's, depression, anxiety, or an extended course about health and wellness coaching, as well as quantum healing, which is related and based on my book, The Dance of Your Core Healing, Transforming Your Mind, Body and Soul in the New World. And you'll find that on Amazon as well. So till next time, much love, take care and enjoy your life.